Hello everyone, you are all welcome to lecture number 1298 and today's topic is uveitis and its causes and symptoms treatment. Uveitis is actually inflammation of your some portion of eye and that portion of eye is called UVA. that is UVE, and that portion consists of your iris, ciliary muscles, peripheral retina, and these portions of eye, when they get acute or chronic inflammation, your vision and your eye will be in problem with blurred vision, and even sometimes if it is not properly taken care and treated, it can lead to blindness and finally to permanent blindness. So uveitis is very serious issue, and it causes sometimes due to bacterial infection or maybe viral, fungal infections, and also sometimes due to injury, and also due to some stress, environmental factor, or once you are suffering from some autoimmune disease. So these are all factors responsible of such type of eye acute and chronic inflammation of that UVA area, and once it is having inflammation, it is called uveitis. So uveitis is serious in the sense that if it is not taken care, it may lead to cancerous condition that is called eye cancer. And once anybody who is having such eye inflammation in that area of eye, that is UVA area, and having uveitis. Uveitis is really serious condition. It can lead to glaucoma and also with the dry eye. So many factors are there, and it's all nothing but inflammation. And if you remember, I'm always saying, I will go on repeating, the mother of all your health condition, whether it is eye, your kidney, heart, lung, brain, joint, the mother is inflammation. So if your overall inflammation is controlled, definitely that will not reach to your eyesight. Why I am taking this topic? Because it has been reported in many research publications that those who are suffering from ankylosing spondylitis, where spines are having inflammation and they are fused, and that one goes to your skull, and from skull, if it is not properly treated, it may lead to your eye inflammation. And first your inflammation will be the eye portion, that is UE, means uveitis will take place. And once your eye is, that portion is in chronic inflammation, your eye will become red, and usually it will become red, and it will appear with red thread, and also sometimes you will feel that in the space of eye some spots are appearing, or maybe some butterflies moving, or some duck is swimming in that space of eye or area. So these are all the symptoms of your this uveitis, and I am going to show some of the images. So you can see here the very clear picture of UVA area, and in that area there is iris, ciliary muscles, and peripheral retina. So that area, what it is shown very clear picture, is having inflammation, and that inflammation is dangerous to your eye vision, to your iris, to your retina. You may get even cataract, or your retina may be damaged, and it may lead to first blindness and finally complete permanent blindness. And now, so now here you can see very clear picture of UVA area, that is iris, ciliary muscles, and peripheral choroid retina, and that is your black spot what it is showing in your eye, blue eye. That is the main part, and that if it is having chronic or mild, or I can say that is the inflammation is in the beginning, you will get pain and eye will become red, and that is because of acute inflammation or chronic inflammation. Now this is very clear image of chronic inflammation of that UVA area, that uveitis is there full blown, and because of the inflammation of those 3-4 portions, that is iris, then peripheral retina and ciliary muscles, and it is really dangerous condition. And if such situation is there, better consult your ophthalmologist and get their advice and diagnosis. Now here you can see the red threads are appearing. So that red thread which are appearing is all coming because of inflammation of that area of iris and ciliary muscles, and then it is becoming red. It is nothing but because of uveitis, and that chronic inflammation is there, and it should be immediately treated. If the care is not taken for chronic inflammation or acute inflammation of this area, that is UVEA area of eye, then definitely you are on the road of blindness, you are on the road of glaucoma, and finally cancer. So number one, uveitis is the inflammation of UVEA area, and that UVEA area consists of iris, retina, periphery, choroid, and ciliary body, or we can call it ciliary muscles, and I have shown you each part in the image. Uveitis can affect one or both eyes, and there are mainly 4 types of uveitis which are given here. Number one is anterior uveitis. It is all inflammation. So anterior uveitis means it is the inflammation of iris and ciliary muscles. Number 2 is that is intermediate uveitis. It is the inflammation of gel which is there inside our eye. Gel and peripheral retina is all inflammation. Then number 3 is posterior uveitis, means it is the inflammation of choroid retina. And number 4 is that is pen uveitis. Pen uveitis means it is the chronic condition of the inflammation of the whole light area which consists of iris, retina, and ciliary muscles. Number 2, causes of uveitis. Number 1, bacterial, viral, fungal, and parasitic infections. Number 2, autoimmune disease, those who are suffering from rheumatoid arthritis, where your normal immune cells start attacking to your normal body cells, and there you get lot of immune problem. So that is one of the cause. And then number 3 is that is once you get sometimes serious eye injury. And number 4 is cancer. If uveitis is not taken care in the beginning, it may lead to eye cancer. Number 3, symptoms of uveitis. The first symptom is you will be feeling discomfort because always your eye will be paining and itching and it will be having a red color. Number 2, redness of eye. And number 3 is sensitivity to light. Once you are going under sunlight or any dark light, you will not be feeling comfortable. You will be very sensitive. And then floaters. Floaters means you will see in your vision space sometimes some spot, sometimes fly is flying, or maybe sometimes duck is swimming, such type of things you will see. Then number 3 is treatment of uveitis. Number 1 is anti-inflammatory drug medication. Number 2, that is antibiotics, antiviral, and parasitic drugs treatment. Then number 3 is immunosuppressive medication. And finally, we should go for surgery to remove all those inflated material from that area. That is, surgery means remove inflammatory masses from that area. Number 4, what are the complications if it is not attended in the time? The first complication is vision loss, and it may lead to permanent loss of vision. Number 2, your chance of getting cataract, poor vision, blurred eye, dull eye is because of uveitis, which is there for long time. And then number 3 is glaucoma. Means if again it is in chronic condition, it may lead to glaucoma where your retina will be damaged, and also you will get dry eye, means lot of inflammation is there. And finally, if it is in chronic condition, it may lead to eye cancer. So it is very, very important we should take care of uveitis condition of that eye area, because your natural beauty and everything what you are enjoying is because of your normal eye vision. Once again, thank you very much for watching the lecture.